Oops. Excellent. Well, welcome everyone. Thank you for being here, for taking time out of your busy schedules to be here with me and Dr. Krystle. This is the second part of our three-part series. Tonight we'll be talking about the mother, and that time frame and how to support being a mother. As I mentioned, we are recording this seminar, so I will be sure to send this out to everyone who signed up tomorrow. And then if you have any questions throughout the presentation, feel free to put those into the chat. Otherwise, there will be some time for question and answers at the end. And then with that, I will hand it off to Dr. Krystle.
Hello, everyone. I am so excited to be here. I am just going to share my screen. Hopefully.
And oh yeah, okay.
There we go. Oh, go ahead.
I was just going to say I made sure that you could share it this evening. So
Perfect.
yeah.
All right. Let's go see if it lets me go to full screen. There we go. Okay. I'm going to move you guys over to this left side so that I can see a little bit better. Okay. Well, welcome everyone. Like I said, I'm so excited to be here and continue this. I've had a lot of fun putting these together for you guys. So this session is, like she said, about the mother. I want to first, though, let you know a little bit about myself. So I am from Advanced Medical Twin Cities, and we are in Golden Valley. And we're a multidiscipline clinic. So I joined my dad in practice in 2010. And I'm a chiropractor, I'm a dietitian, I'm an acupuncturist and a lactation consultant. So that's my wheelhouse. But we have massage therapy and mechanical traction, and my dad and our associate, my dad, Dr. Arlen, and my associate, Dr. Billy, that you see up there, both specialize in other things too. So like injuries and sports and all kinds of things. So we have kind of a full array of being able to help everyone. But my, I don't want to say my favorite patient, but the ones that I really like working with are women and children. So this is right up my alley of something that I like to put together. And here's my moment. I know Judy has seen this already, but this is my kids. So I have to share my kids because I am a mother, and that is one of my prides and joys and why I do everything. But this is also my little moment of disclaimer. This one does have a little bit more information in it that may be different depending on if you're trying for fertility or if you're pregnant or postpartum. So definitely, if you have any questions, make sure you talk with a provider before you start or change anything. All right, we'll get into it. And I put this on this side and I'm realizing all my words are on that side. So I have to move you guys over again. I'm sorry. Okay. So our goals for today, we are going to look at how the mother, and by the mother, we don't necessarily mean you have to be a mother, right? So this is the childbearing years. So they've had a well-established cycle, maybe for at least a couple of years, and then we're going through until peri and menopause and that sort of stuff. So this is just, you could have a baby if you wanted to, kind of time frame, right? And what we're going to look at is how the body structure can modify the function internally as a woman. So some of the things that may change there, how movement can influence our cycle and regulation of our cycle, and then what we can do to help our body out. So just some tips that you can take from this talk right away. So we are going to start there. So what are the most common stressors for the mother body? So when we're looking at this age range, what are the things that pop into people's minds? Typically, it's going to be a lot of these sorts of things. And like she said, if anyone has any questions or wants to make any comments during, feel free to unmute yourself or put it in the chat, and we'll definitely look at that. Especially, this is my 2 cents that I got from my dad, is especially if you don't understand something I said, please stop me right away if I'm saying a word or something you don't understand, because I don't want you to just be focusing on that and not getting the information. So definitely let me know. But some of the big stressors on our bodies are poor posture, right? So for multiple reasons, but maybe we've just grown up that way, or maybe we have poor posture because of some of the other things we do. For instance, work. Work causes a lot of times we might have physical and emotional stressors too. I like to talk about the triad of health. So if you think of a triangle, you can have your chemical, physical, and emotional sides of the triangle. And if we have our triangle like this, and we're working on just the physical side, right? So maybe we're just trying to help our posture. Then that one point of the triangle is having to work really hard to pull the rest of it up. So if we can work both that and chemical, and by chemical, it means like what you put in your body, not actual, we're not talking about bleach, or anything like that, but the foods and nutrition and things that Phyllis will talk about. If we work both of those sides and then emotional side in whichever way you choose to do that, that can just help you get healthier and healthier a lot quicker. So that's what a lot of this looks at, is all those different kinds of stressors, pregnancies or lack of pregnancy, right? Maybe you're trying it to get pregnant. Work, we talked about injuries, car accidents, sleep positions. That is a huge one. I think a lot of people don't understand. Our necks are not made for us to sleep on our belly other than when we are a child. So when we're younger, that's different. But at our ages that we are in this mother stage, sleeping like this is not good for you, right? So we gotta work on those sorts of things. Sleep is 1/3 of your day. So however you're doing that, it makes a big difference on the rest of your body and how your body can respond and react. Lack of activity can also cause stressors. And then we talked about the chemical and emotional. I'm sure you guys can think of a lot of other things too. Money or lack thereof money. That's another big stressor for this age range, right? Okay, so how or why does body posture affect our cycles and fertility? And when I'm talking a lot about fertility and our cycle and pregnancy, anything like that, think about that as me just talking about optimal health. So for this age range, to have optimal things working optimally within our body, we should be able to be fertile. We should be able to conceive or have things. There's of course all sorts of reasons that isn't the case for people, but what we're focusing on is that we're looking at optimal health. So poor posture or positioning can actually lead to pelvic floor dysfunction. So the pelvic floor is that group of muscles and parts at the bottom or base of our pelvis. So it's literally the floor holding everything together. And when we slump over like this, we're not activating our core and lifting anything up. Our pelvic floor gets kind of, it just stops working the way that it's supposed to work. It gets weak, and we can have all sorts of problems. We can have a leaky bladder. We can have pressure on our organs. So that can cause things like leaky bladder. We can have decreased blood and lymph flow. So if you think about that, if we're not getting good blood and lymph flow, I know some of my patients I work with get a lot of like pooling or swelling in their feet and legs. That can happen with that. We're also, if we're not getting good flow out of that lower half of our body, we might also have some issues with our cycle. And that a lot of times can lead to more painful or more other side effects that can come along with PMS and things like that. And there's also that decreased communication and delivery of hormones. So if you think about that brain, you have the spinal cord going down and nerves going out to every part of your body, including your organs, including your pelvic floor. It's kind of like they have decided maybe that, oh, we're gonna close the diner for the day and not give that signal back up to the brain saying, hey, we're gonna have our period now. Maybe start getting some of those hormones and getting some of those nutrients that we need and pulling things together into this location. And instead of that happening to prepare, it all of a sudden just goes, whoa, we're here already. Here's a party. And our body just doesn't have that going back and forth. So that's where that part can come into play and really affect how our posture and positioning can affect those other parts. Okay. This was a slide I know that I had before, but it is just such an amazing stat that I really want to make sure everyone knows. Just by improving your posture, you can improve your cortisol levels. So cortisol is our stress hormone. Stress, when we have our stress hormone going crazy in our bodies, we don't release as much of the happy hormones, and we don't function and move and can't regulate our mood and everything else as easily. So doing something, if you're really stressed, doing something as simple as for 2 minutes, only 2 minutes, really sitting with good posture and taking some nice deep breaths, that alone can significantly decrease your cortisol level. It can improve your cycles and improve your fertility, because that lower cortisol basically helps our whole body function better. All right. Movement. And this one I think is a big, it varies a lot for people. So, and different parts of our life. So different ages and everything. When we talked with the maiden, we really focus on get out, move, getting that full hour of activity, and really focusing on structured exercise. As we age, we still structured exercise is still very important, but in the sense of how our body regulates, regular movement is more important than anything with exercise, not anything, but with movement and exercise, just moving regularly. So for instance, if we have regular movement and we're doing, let's say, we're going for 3 walks a week, and we maybe get in, if you're a person who does typically do exercise class, or you do even just some exercises at home or things like that, keep being consistent is going to be what regulates that. If you are someone who is getting too little movement or more sedentary lifestyle, that is where it starts increasing your risk of different menstrual disorders. It also increases the side effects of your cycles. So that PMS and those sorts of things. But remember that what I'm trying to get across with this is it's all varied depending on you and what you've been doing before. So if you're starting sedentary and you go too much too quick, so what that means is, okay, I haven't done anything in even a month, right? So even a shorter amount of time, let alone I haven't worked out in years. Either one of those things, when we start into an exercise routine, one of the worst things you can do is throw yourself all in immediately, in the sense of how your hormones respond to that and how your body responds to that. And that can actually cause amenorrhea, which is pretty much a loss of your cycle. Or if you haven't had your cycle yet, if you're over 15 and you didn't get it, that happens a lot in like very high intense athletes, especially like gymnasts and people like that, where they don't even get it until they're 18, 19, which is not good either, but that's a different topic. So for here, we're trying to regulate. We don't want to all of a sudden jump in hardcore. We want to gradually come in. So maybe instead of you haven't been doing much and you're going to start a new routine, maybe go at it a little bit less. So maybe for a week or 2 weeks, you're going to slowly gradual in. And then by week 3, you can get into that full workout cycle or movement cycle. Now, when I'm talking about this too, it might not be a full workout, right? If you haven't been doing anything, maybe your goal is just you're going to move your legs and bring them back and forth every time you hear a commercial. And then after that goes through, maybe you're going to then move into, I'm going to walk around my house, or I'm going to take baby steps, basically, is what I'm saying. So whatever those steps look like to you, really pay attention to your body, how your body's feeling. If you are insanely sore the next day, I know I sometimes do something, and the next day or 2 days or 3 days later, I can't move. You probably went a little too hard. If you're like, "Oh, I'm sore, but I feel this, but I can still function," that's what we want, right? So we want that gradual increase where we're not getting so much that you literally can't do anything, and then you a lot of times just quit what you're doing anyways. There is also the one more piece on this that I wanted to chat about is during your cycle. So there's a lot of variation in what people think of it, what they should do for movement during their cycle. There are some people that have such intense periods or symptoms that they can't move. And that then you got to work more with Phyllis and work on the internal side and the structure of the pelvis, and that can help a lot with that side. Then you can maybe start moving again. There are other people that say if I don't work out when I have my period, then I get bad symptoms. So that can happen too. But the main thing is that I do want to express is a lot of people think that movement during increases their flow. And in a sense, it can, because it increases the amount of flow that you release during that time, but it actually can decrease the length of your cycle because you're cleaning out the house a little quicker by getting some of the sheath off a little bit quicker. All righty. All right, nerves, muscles, and spine. And there's a lovely pregnant belly. When I took that picture, it was height of COVID, so we were having to use gloves and everything. I got to get some new ones without gloves on it. But anywho, the main thing that I want to talk about here is that I use as a chiropractor a technique called Webster technique. And that is something that is specialized for pregnancy and for labor and delivery. And it can decrease chances of back labor. It can help with baby positioning, helps with postpartum recovery for mom, and helps with problems during the pregnancy. So any pain, symptoms, that sort of stuff that they can have. But it also, if you think about it, if what it's doing is prepping the pelvis to be in this optimal position for labor and delivery, it's also getting it in that optimal position. And this is my own theory, I will say, on this part. But I have found with multiple, over 100 patients, that people that have really irregular or strong cycles, or that are having fertility issues, things like that, that working with the pelvis in that same way can actually help with a lot of those symptoms as well. So we're increasing that flow, going back and forth to the brain, and all of that. There's also a lot of acupuncture points that can be used for pretty much all women issues and everything. I am not a specialist in all of those things, but there are a lot of acupuncture points. There's a lot of body work, craniosacral therapy. There's massage therapy, a lot of things that we can do to help our body function in its optimal way. So I highly, highly recommend from here, just that if you haven't yet and you're having any sort of like women regulation issue, is that you get yourself checked out. All right, we're gonna I'm pausing that. Okay. So what can we do? First of all, check your posture. So I love to have someone else record me when I'm working sometimes, because I don't realize how horrible I am, like slouching or sitting, especially if I'm on my computer. When I'm out treating patients, if with the patient's consent, of course, I sometimes have my interns record me so that I can make sure that I'm keeping proper body mechanics. And like I said, you might be really surprised. So getting a picture from the side, from behind in your workstation is really a great way to take a peek at that. If you want to work on sleep or anything else, you can always let me know. I can get you some tips for those things too, for that position. Next, we want to work our core and connecting the sides of our brain. And that is this video, which I shared last time, and I will share it again. It is silly, but I'm a fan of row, row, row your boat. So no, I'm just kidding. We just want to tie the different sides of our brain, and it's really good for anybody at any age. So we're going to watch this quick. All right. So that's called the neuro boogie. I don't think I said that before, but it's just kind of a fun exercise we can all do. The next thing is encourage movement. I really movement is so important in whatever that looks like for you. Like I said, you're welcome to chat with us about trying to help you with what that looks like to increase your movement in a way that your body and your hormones can handle properly. Pelvic tilts and adductor stripping. So pelvic tilts, everyone and their mothers should be doing them. With that, what you're going to do, and they're kind of in position in this top picture to start. But if you lay on your back, or you can do this sitting or standing, I say that it sounds like, or you think about like you're being punched in the gut. So if someone were to punch you in the stomach, your belly button would pull into your spine. That kind of flattens your low back, and we squeeze our glutes together. So we're kind of getting this tuck action under there, and squeezing those glutes together, pulling that belly button into the spine.
Is it just me that's frozen? Okay.
No, it's
I,
glitching for me
I
too.
think Krystle is frozen.
Okay. Oh, she's gonna come back. Excellent. Okay. Strange. Huh. Does anyone have any questions so far? I mean, not that I can necessarily speak for her, but I can do what I can.
I'm eating, so that's why my camera's off. But
Oh, that's okay.
I think it was just a really good reminder to like exercise, just to like
Mhm.
go slow, just because I know I kind of get in these like, waves of being motivated to work out, and I kind of go like big and hard.
Yeah. Yep.
So that was a good reminder just to
I'm sorry, I
easy.
don't know what just happened.
Oh, that's okay.
I'm
Technology.
sorry.
Zoom. It's Zoom.
I know
Yeah.
it just like logged me out and redid me in. I don't know. But that was pretty much my thing. Next thing was just, stripping of the adductors. Doing that is actually good for everyone. Yes, Judy?
Could we hear, we didn't get the pelvic tilt. It kind
Oh.
of dropped off and froze. We got part of it, but not the whole thing.
Okay. So with the pelvic tilt, I'm sorry about that. If you think about, did you hear when I said being punched in the gut?
Yes. Yep.
Okay. So yeah, with that, we just want to make sure that this is isolated up here. And then down here, we're really pulling that belly button into the spine, squeezing the glutes together to tuck kind of under, hold for 2, 3, 4, and then relax. And then pull up and under, 2, 3, 4, relax. So it's just, you're really only moving an inch or so, inch or two, not a big movement. You can do them in any position. I do them when I'm brushing my teeth every morning. My goal is 80 to 100 a day. but they do not need to be consecutive. They don't need to be all in at a time. But that's really good for just stabilizing a lot of that lower pelvic floor and core. And then the adductors, you just want to make sure with that adductor stripping, if you are, did you hear me say if you're pregnant not to do that? Okay, good. I'm happy I'm saying this. So we do not want to do adductor stripping if we are pregnant because it can release oxytocin, which can contract the uterus. So unless we're trying to have the baby, if like, hey, you're running a little behind schedule here, then you can go ahead. But the adductors are the inside of our legs. So I really like people to know that. One of the things, because it can release oxytocin and because it's so close to a lot of our organs that all of our womanly organs, working those areas can help with a lot of women's health issues, irregular cycles, painful cycles, having anything where we're having increased stress. So it's just really good for all of that. I use a rolling pin. So just you'd be rolling out cookies, you can use a rolling pin. You can also use a foam roller, anything like that. Just make sure your last roll, you go from the inside of the knee up towards the groin. And the last stroke you do always needs to be up and towards the heart. So always up towards the heart. So we're flushing that blood and lymph up and away. We don't want to push it down towards our feet and getting, everything pooled downward. We want it up and out. And then getting yourself checked out by a professional absolutely is also a good thing to do. You can chat with either one of us on that. And then here is just my offer again, if anyone is interested with this topic and everything, is a free checkup and care plan. If you have any questions and you want to talk either in person or virtual about any of these things, I am more than happy to elaborate and everything further. I know this is just like a quick little taste. So yeah, does anyone have any questions right now?
Are Kegels still like a thing, or would you recommend other exercises? Okay.
So I typically will try and do a Kegel right along with the pelvic tilt.
Okay.
There are a lot of apps, and there's even like game things you can do for different Kegel and pelvic floor exercises. So if you ever want to look into some of those things, they're very interesting. You like play a little, it'd be like a little like a Mario Party kind of thing, and they're pretty funny, but they're great to do, and they can help us, especially women tend to have an issue with kind of bladder control and coordination, and this, you can be too strong there. There are times where things get too tight, but that is very rare. So for the most part, most of us can be working on those. Absolutely.
Okay. Cool.
All right, cool. Well, thank you, you guys.
Yeah.
Thank you.
I'll stop sharing my screen, and then Phyllis can take over.
Excellent. Excellent. Well, thank you, Dr. Krystle. Whoa, sorry. Oh, this is a mess now. Okay. You're in the way, everybody. All right.
I know I was having to glide it around, figure out where it could be.
Right? Yeah. Okay, there we go. Yay. All right, well, welcome everyone. I know that everybody that's here now knows me, but for those who will be watching this, watching the recording, my name is Phyllis, and I am the founder of Sacred Ibis Botanicals in Hudson, Wisconsin. I'm a master herbalist by trade, but my specialty is supporting women with hormonal imbalances like endometriosis and fibroids to be energized, pain-free, and to feel like themselves again. And oh, I'm sorry, I can't see you guys, and I'm doing my slideshow, and it's making me. Okay, well, anyway, just shout out if you have any questions, because I can't see anybody right now, and I want to keep moving because we're almost at our time limit here. So in my practice, what I see a lot of, or what I feel is kind of my just what I see in my practice is there are a lot of nutritional deficiencies that I think contribute to the symptoms that we see as hormonal imbalance, and that actually are what perimenopause and what menopause are known for, if that makes any sense. So perimenopause and menopause are absolutely normal rites of passage for women, and they really shouldn't be so filled with all of these symptoms of dread and all of these issues that we seem to have here. But I think a big contributor to that are nutritional deficiencies. So in this region, we are nutritionally deficient in 3 specific nutrients. One is vitamin D. So obviously the sun regulates our life right outside of our body, right? Like the seasons, you know, what time of day we're awake and what time we're asleep. And it also regulates inside of our body what's happening too, as far as hormones, mental health, bone health, thyroid health, all of those things. So it's really, really important that we're taking vitamin D. And right now with the use of sunscreen and clothing, we're very often not out in the sun and actually making vitamin D, not to mention where we live at the 45th parallel, we only can make vitamin D for about 6 months of the year. So I recommend taking 4,000 IUs of vitamin D a day all year long, no matter what your sun exposure is, just so that you stay in that pattern and that you keep your vitamin D levels up. There are studies that show that vitamin D levels, you know, kind of between the 50 to 70 nanograms per mil, I believe, reduces hospitalization for things like SARS and the flu by 50%. So it's really, really important to be taking that vitamin D for your immune health and hormone health. The next nutrient is iodine. So iodine is a nutrient that comes from the sea. So we are definitely landlocked here. We are nowhere near the sea. And the only way to really get iodine is from foods from the sea. So then we're talking seaweed, seafood, salmon, any of those kinds of foods. You need to have a minimum of 150 micrograms a day, which most people are not getting here. So I like to add, so obviously I recommend a multivitamin for all my clients, for adults and for children, just because I feel like the way our food system is run now, that you just can't get all the nutrients, even if you do eat a very diverse and very clean diet. And for iodine, I do take a supplement, but then I also add kelp flakes to my food once or twice a day. So that gives me that extra iodine that I need for my thyroid health. And then the third nutrient is selenium. So selenium, again, is a nutrient that comes from the ocean. We are landlocked. There used to be selenium in our soils, but due to our farming practices, most of the selenium has been leached from our soils. And so a great way to get selenium each day is with Brazil nuts. Just 2 a day will have your daily allowance of selenium or more, usually. Another key nutrient is calcium. So for mothers, which, you know, our goal is to have you as healthy as possible in these mothering years, to do whatever you decide to do, whether it's to have children, not to have children, but just to keep you healthy. So 1,000 milligrams of calcium. Pregnancy and lactation, it's 1,300 mils that you need to be having daily. B12, it's the 2.4 micrograms. For pregnancy, it's 2.6. For lactation, it's 2.8. And you can go above these. These are just the minimum requirements needed daily. So definitely, if you are eating more than what's recommended here, that's perfectly fine. In most cases, it would be indicated even to have a little bit more. Protein, you want to have 0.8 grams per kilogram of body weight. So for a 100-pound person, that's roughly 36 grams. For a 150-pound person, that's 54 grams. Zinc is super important for all of our systems as well, but in particular for immune and some hormone. So that's 9 milligrams, pregnancy 12, lactation 13. And then iron. Iron is super, super important for menstruating women, obviously, just because of that blood loss. And so each day, you want to be getting 18 milligrams of iron. In pregnancy, it goes up to 27. So that's huge, right? Because you're holding on to that blood, you're creating that baby. In lactation without menstruation, it goes back down to 10 milligrams. But then once you are menstruating again, you go back up to that 18 milligrams of iron daily. So what is normal menstruation? So the American Committee of Obstetricians and Gynecologists has determined that the menstrual cycle should be the 5th vital sign for teenage girls. So, and I actually think this should be for all women. Like that's what they should be asking when you go in to have a checkup. And it's definitely not something that's asked about. And I think a lot of times when women go in, especially for their period issues, right, they're not heard. They're just told, well, that's normal, that's this, it's that. And most of the time I feel it's not, at least in my experience and the experience of many of my clients. But the normal length of a period should be roughly 3 to 5 days, occurring every 23 to 35 days. The normal blood flow for one menstrual cycle is between 5 to 80 mils. So if one regular absorbency tampon holds about 3 mils and one super tampon holds 12 mils of fluid, one regular pad holds 5 mils and one fully saturated overnight pad is 15 mils. So your period should be, or is, a combination of all of those things, right? So if you can, kind of calculate what you're filling a day and how that's going, you can determine whether you're in that range of 5 to 80 mils. Repeatedly soaking through a tampon or pad every 2 hours is considered heavy menstrual bleeding. So, and I know for some women that might just be kind of how like their first day is and then it tapers off. They may have a 3-day cycle, right? And still be within that 80 mils of blood flow a month. And that's fine, but the heavy menstrual bleeding, especially prolonged, will lead to anemia, and that leads to a whole nother set of issues. And then tracking your cycle is very valuable to get, as a very valuable tool to get the information that you need, especially if you're going to be going into a practitioner, contacting Krystle or me about maybe some things that aren't going well for you. And then, you want to be keeping track of your start date, your end date, and any of those symptoms to help people support you in getting what you need. What is abnormal menstruation? So painful breasts or pelvic pain during ovulation, more than one period in a 35-day span. So if you're having more than one period in a 35-day span, that usually means that you're not ovulating and that there are a lot of different issues going on. And that is definitely something you need to see a practitioner about. Bleeding more than 80 mils per period is a problem in periods that last more than 7 days. Intense pain or cramping during menstruation, especially pressure or a downward pull, pain radiating down the legs during menstruation. So any kind of PMS during the month. So obviously there are fluctuations right before your period as all of your reproductive hormones kind of drop suddenly. But if you're experiencing depression that week before your period, or bloating, or some different types of inflammation and stuff during the month, those are obviously reasons to see a practitioner. Acne, especially cystic acne around the mouth and the chin, and then facial hair growth are abnormal as well. So some herbs to support mothers. So in balancing your hormones, we have chamomile. Chamomile is a fantastic herb for pulling estrogen out of your body, whether it's excess xenoestrogens or just estrogen, and excess estrogen you have in your body for whatever reason. And just so you know, these herbs are general herbs. Every woman is going to be different in what they need based upon those abnormalities that I talked about earlier. Chaste tree berry, that's a great one for reestablishing or producing more progesterone. And ladies' mantle is just a great all-around kind of tonic for the uterus. Heavy bleeding, these are the 2 herbs that I use with my clients who have hemorrhaging during menstruation or just heavy bleeding. Shepherd's purse and yarrow are my 2 go-tos for that. For cramps, ginger is fantastic. You can take just a couple slices of ginger, put them in a cup, and pour some hot water over, just enough to kind of cover the ginger, let it steep for a little bit. Then you can put those pieces of ginger in a cloth, and that water, you want to soak that up and just press that onto your abdomen. That will help with the cramps. You can also make yourself a cup of ginger tea to help as well. Motherwort is another great ally, as long as you have normal bleeding, because it is an emmenagogue and it can cause further bleeding, and you don't want that if you're already bleeding too much. Red raspberry leaf and chamomile are both just great supports for that. Red raspberry leaf is astringent, helps tone that uterus, and then chamomile is a nervine, so it helps relax muscles, relax the mind to help relieve cramps. Many women in this age group also suffer from mild to moderate anxiety. So linden is a fantastic support. It's a very gentle nervine, specifically recommended for kids with ADHD. Moving on to something a little bit stronger is lemon balm. This is a great hypotensive, so it helps reduce blood pressure. And then is it just a little bit stronger of a nervine, so it's indicated for a little more stress. Chamomile, everyone knows lavender, and then oat straw. And I'll talk about a little more about oat straw in a moment. Flower essences are a fantastic subtle plant energy that's used to help release negative emotional imbalance. So part of my training is that we create these blockages, whether it's something that or as a reaction to something that happens to us, or just that we form in our mind, right? So in all of the things that we tell ourselves over time, right? Like if we had an accident, we got hurt, and your body is consistently telling yourself you're still hurt, right? Like your body is not going to heal from that. And flower essences are such a wonderful, gentle support to kind of help us replace those narratives so that we can have long-term health. And I love to pair them with affirmations, because when we're releasing these negative emotional imbalances, we want to bring in a positive affirmation for that to replace the negative with something positive so that we can have lasting health. Mothers, we also see a lot, at least for me, I know many of my clients, skin eruptions. So skin eruptions are telling us that our liver is a little taxed, and to help support the largest organ of our body, we can use bitter foods, and bitter foods needs to be tasted on the tongue. But using dandelion root, burdock root, yellow dock, chamomile are great herbs to take as a tea, as a tincture to help support that. And plantain oil topically can help with scarring and any sort of eruptions that we have and healing them faster. And then adaptogens. So one great group of herbs, adaptogens, help us acclimate to our stress, not necessarily, it's not meant to make it so you can take on more and more stress, but just to help you acclimate to what you have. And some mother specific, like this time of life, adaptogens that are super supportive are ashwagandha, rhodiola, schisandra, and licorice root. Supportive foods. So we're looking at anything that's high antioxidant, especially leafy greens, brightly colored vegetables, seeds, berries, and nuts. So we want to get those macronutrients of protein, fiber, and fat, right? And in a good, healthy ratio. So I also recommend herbal infusions. Those are some of my favorite things. It's a tea that's steeped for 48 hours. So you're using water to extract the water-based mineral and macronutrient constituents of stinging nettle, oat straw, red clover. Red clover is a great one for women who are going through menopause and struggling with their estrogen levels. And it's also great for women who are wanting to get pregnant and just helping kind of modulate the estrogens that you have in your body. And then red raspberry leaf are all great. Lots of nutrition, protein, all the micro, manganese, calcium, magnesium, just great for all stages of life. And then when we get into this stage, due to different things that have happened in our life, taking antibiotics, synthetic birth control, food poisoning, any sort of like gut intestinal thing, probiotic foods are really, really great support, and they add live good bacteria and yeast to your digestive tract. So we're talking about all those fermented foods, right, that have these bacteria in them that'll be super helpful. So yogurt, kefir, fermented vegetables like sauerkraut and pickles. So we're talking about the stuff that you find in the refrigerated section, not on the shelf. If it's on the shelf, that means it's been canned, it's been heated, and that those microbes are no longer viable. Other options are kimchi, miso, and kombucha. And then probiotic foods that help feed beneficial gut bacteria. So you want to introduce good bacteria, and then you want to feed them the good stuff that they need to grow big and strong. And we're talking about herbs such as chicory root, dandelion greens, and dandelion root again. Quercetin, vegetables like garlic and onion plants, asparagus, banana, burdock, flaxseed, seaweed, and avocado are also great prebiotic food choices. So that is my presentation. If you want to connect with me, I do offer a free 30-minute healthy hormone strategy session. So there's the link there to schedule that. And if anyone has any questions, you can just let me know.
Hey, Phyllis, I have a question.
Yeah.
The herbs that you were listing on the couple slides ago,
Mhm.
you talked about infusions, but the other ones you listed, like, how do you, I guess it probably depends on like what symptom you're after, but can you do infusions with like all of them, or?
No, you just want to do infusions with nutritive herbs that you're trying to get nutrients out of. So that's why you're using the waters to get the nutrition out of it. So if you're looking at, say, sorry, I'm going to that slide so I can look specifically at that.
So that's good.
So say we're talking about balancing hormones or chamomile. So yes, you're going to take a tea of that, but the chamomile will get so bitter after 5 minutes that you won't even be able to drink it. And then it doesn't have as many of the it doesn't have any of the macronutrients or anything like that. So that's more of you're going off of like specific water-based constituents for those nervine properties versus the nutrition properties, if that makes sense.
Yes, yeah,
Mhm.
it makes sense. Okay.
Yeah.
Thanks.
Thank you for the question. Yeah, anyone have anything else? Okay, thank you.
No, I
everyone.
think that was great though. I always learn something from you.
Thank-
fun.
and likewise, yeah. I know we've all been working on the what did you call it? The neuro boogie?
Neuro boogie.
And posture for sure.
All
So
ages.
yeah.
Good.
Yeah, I was gonna say that was how I realized. I mean, I knew my pelvic floor was in trouble, but I had seen a picture that one of my kids had taken me of how I was standing at the counter, the kitchen counter. This was like 5 years ago, and I was like, I need help. Like that is not good. Like President Trump stands, so forward, and that is like a big sign, right, that his core is not functioning properly.
Yeah, I think it's so those when you're the person in the background kind of pictures,
Mhm.
you just see so much about yourself.
Yes.
How other people actually see you most of the time.
Right. Yeah.
And it can be eye enlightening for sure.
Absolutely.
Okay, I'm gonna go through my pictures now and see.
But don't be harsh. No judgment. No judgment.
No
Just, like,
judgment.
it's
No, just to learn, just to get
just
more
to learn.
information.
Yeah.
Yeah. No. Yeah. Well, thank you everyone again for your time and for being with us, for all the great questions. And if you have any other questions of us, just let us know. You have our contact information, and I will send this out, the video out to everyone tomorrow.
Perfect. Thank you.
Thank you so much.
Thank you.
Thank you.
Bye.
Bye.